I'm very pleased to introduce our presenters for this session, Dr. Jennifer Howard and Dr. Nicole Snow, both assistant professors with the Faculty of Nursing, St. John's campus of Memorial University.
Thank you. I'm just very mindful of the fact that I am now in sharing my screen. I don't see the chat function. So Jennifer, would you mind keeping an eye to that and just let me know if there's any questions in the chat? I have it set up so I can see hands being raised, but I'm trying to figure out how to set it up so I can see the chat, but I can't do that. So Jennifer will bounce that back and forth. Okay, perfect. Thanks, Jennifer. So welcome, everyone. Thanks for coming, for signing into this session. We're going to talk about the use of student-recorded video assessments in nursing education during the COVID-19 pandemic. And certainly, while this is our experiences as nursing faculty, we are quite certain that there's been challenges and benefits experienced by other faculty within university and in using recorded assessments during the pandemic and in trying to meet the challenges that the pandemic presented to us. So the objectives for this presentation is that we hope that you, as in attending, will develop a better understanding of how video assessments have been implemented at MUN during the COVID-19 pandemic. And for those of you who, we do see some of our colleagues here on the screen. My apologies, my mouse seems to be a little bit sensitive here now today. See some of our nursing colleagues who are signed into this presentation, and thank you for that. We see some names that we're not familiar with, and interested in hearing from you about how you've experienced anything like this, or if you have. And we also hope that attendees will be able to explore the pros and cons of implementing student-recorded video assessments during the COVID-19 pandemic through open discourse with colleagues who have engaged in the use of video recorded evaluations.
So for our current problem, during the COVID-19 lockdown, post-secondary students are reported in the literature as experiencing a change from in-person to remote delivery for their learning. This included the use of student-recorded video evaluations for assignments that would be delivered in person. This rapid change to the delivery of curriculum and evaluations has been causing reported issues from students at MUN, such as increased anxiety and exacerbating body image issues. So for Canadian baccalaureate students, they've had to adjust navigating to online remote learning due to the COVID-19 pandemic. This may prevent students from gaining meaningful tactile skills in courses that would generally have been delivered in person. This was problematic for professional healthcare programs specifically, and for example, nursing schools, as students are expected to learn skills to assess and care for the health of their patients. This teaching is often firstly learned and evaluated in a laboratory to practice and evaluated in person for skills such as assessing vital signs. As a result, there was an emphasis on student-recorded video assessments for courses that would generally be delivered in person. There has been an increase in students vocalizing issues with this form of evaluation for courses that has traditionally utilized student-recorded assignments as well.
Hi, Jennifer. Sorry to interrupt there. This is Paul. Your video's off there, just to let you know as well.
Oh, okay. Wasn't I supposed to keep it on? I'll turn it on. No problem.
Just want to put the reminder in there. Sorry.
Oh, no worries. I don't mind. So the COVID-19 pandemic necessitated the delivery of evaluations to accommodate remote delivery. This included post-secondary educators implementing student-recorded video assessments in lieu of traditional face-to-face evaluations. Video assessments have been utilized in undergraduate nursing education effectively both before and during the pandemic. However, the practice presented unique challenges when assessing practical nursing skills. Globally, educators were tasked with rapid adaptations for their courses from in-person to remote delivery during the COVID-19 pandemic. This transition necessitated the use of evaluations that could safely be implemented to avoid unnecessary person-to-person contact. This included student-recorded video assessments in undergraduate nursing education to demonstrate interventions such as psychomotor and communication skills. There are numerous benefits reported in nursing literature that support the use of video assessments. These include a potential increase of self-confidence in some learners and expectation for comparable outcomes. For example, final scores were seen as similar compared to traditional face-to-face evaluations. However, there is limited evidence in the literature outlining the barriers and limitations of which nurse educators should be aware when implementing this form of evaluation. A group of nursing students have described feelings of increased stress when having to submit self-recorded video assessments, such as an increased anxiety and concerns with body image when submitting their work. This prompted the authors, so both Nicole and I, to engage in reflection using the theory of reflective practice in nursing to determine aspects of self-reported video assessments which may present as challenges for some learners. Gaining a deeper level of understanding of the benefits and challenges of students' recorded video assessment evaluations may help us as educators through increased awareness and promote inclusivity when incorporating these assessments.
So you can just make comments in the chat box, but we're really interested in who has used video assessments in the classroom. Nursing, non-nursing courses, whoever. We'd like to get an idea of who's used this method of evaluation or a method of student assessment in the past. Or you can put up your hands if you wish to do that. Put up your raise hand feature. Okay, Brenda Wyatt. Okay, yeah. Jennifer, anybody you see from the chat?
We have someone, sorry, I just needed. We have Vicki Paddock in health assessment, and then we have David Stokes, so for medicine,
Okay.
pharmacology labs, as well as health assessment labs.
Okay,
So it's
great.
got a good interprofessional mix on it, sounds like.
That's great. Yeah, yeah. And one thing I didn't do is, who at the beginning, who is here? If you could put into chat, I see nursing, so we have pharm, we have medicine. Any other disciplines? Any other areas of study? Put in the chat.
So Candace A would be from pharmacology as well.
Yeah.
And
Okay.
Vicki Paddock, she's doing health assessment, but I'm not sure on the discipline there.
Yeah. Yeah. Okay. Great.
Oh, Vicky's in nursing as well.
Okay.
And she does the farm labs as well. That's
Okay.
great. That's Candace. Okay.
So.
Someone from ocean sciences and education as well.
Okay.
And
Great.
medicine.
Excellent.
Yeah, lovely group.
Excellent. So, does anybody want to share how they have used it? You can raise your hand and we can call on you, or if you want to type it into the chat, you can. But how have you used your the video assessments in your course?
So we have David has his hand up. So
Yeah.
Vicky's
David,
at the library. She's going to type.
David, you can jump in. How have you used it?
Hi, I'm David Stokes. I'm instructional designer with the Faculty of Medicine. We have used it in two ways here in medicine. One being with research presentations. So our students would prepare their PowerPoint or their posters, and then they recorded themselves doing their presentation and have posted that for assessment. And the other one, which was far much more complicated, was clinical skills physical examinations. So that one was really complicated because our students had to find someone within their bubbles to act as their standardized patient. They had to set up their space and get the lighting and using their own devices to record. Often those videos were really long and thus the file size was very large. So getting them onto D2L was quite difficult. And a lot of the comments that you made earlier about uh, body image, putting themselves out there, seeing inside their homes, using their friends and family to be involved as well. That one was quite challenging. The videos for poster presentations and PowerPoint presentations went really well, and we didn't get a lot of concerns or negative feedback about those. But the clinical skills ones, we received a lot of feedback about those.
Okay. Okay, great.
Okay, thank you for sharing, David.
Thank you. Yes.
No problem.
And they are quite challenging to um, to try and do, and do it well, and it's very difficult. Anyone in the chat?
From Vicky Paddock, she says, when we quickly switched to remote, I had scenarios I normally use. I sent them to student via time scheduled emails. They had 30 minutes to read, video record demonstration, and upload to Brightspace. So that
Okay.
sounds like that might have been a bit stress-inducing to say the least. I know for me with technology, I'm always getting a little tripped up here and there.
Yeah. Well, thank you for sharing, everyone.
But a
We
good
wanted
habit.
this to be interactive. 15 minutes for a presentation is a gift. So
Yeah, jump on the
I've done
video.
5, so we certainly wanted some discussion because we wanted to facilitate people's understanding, certainly. So you can participate as much as or as little as you wish, but we certainly appreciate you contributing your experiences. So thank you. So the next thing I'm going to talk about that we're going to talk about is the theory of reflection. And, to be able to consider how this might be affecting an individual, might be affecting us as individuals, as instructors, an individual as a student, we really must think about how and reflect upon how these experiences are contributing to any anxiety or stress that we're experiencing or any other feelings. Again, we've had students, talk about body image. And so we wanted to talk about reflection because we certainly encourage our students throughout the course that we use this video assessment and to be able to develop the reflective skills. And in doing so, we probably will get a lot more students talking about their experiences. So in the School of Nursing and the Faculty of Nursing, pardon me, at MUN, we use John's model of reflection to help guide student reflection. And this is comprised of 5 phases the student must consider when engaged in reflection on practice. And these 5 phases are located there on the right side of your screen. And as you can see, reflection is a circular process that's designed to help students make meaning of their experiences and to better understand the impact of their behavior and skills. So these 5 phases are description of the experience. So what happened? What might have contributed to the experience? What are the key processes for the reflection in this experience? What's going on and what happened? Reflection, thinking about what was I trying to achieve, what I was doing, why did I intervene as I did, what were the consequences of my action, how did I feel about this experience when it was happening, things like that. The influencing factors, of course, what's going on that could be impacting on the experience. So internally, what's going on within the individual, and external factors that could influence my decision making, and what sorts of knowledge did I have to influence my decision. Then the 4th stage is evaluation. Could I have dealt with this situation better? What other choices did I have? What could be the consequences of these choices? And then, of course, learning. How do I feel about this experience? How do I make sense of it? How has this experience changed my way of knowing? And in nursing, we talk about ways of knowing, from aesthetically, personal ways of knowing, ethical ways of knowing, empirical ways of knowing, and sociopolitical ways of knowing. And I'm not going to get into those right now, but certainly we talk about that, how just as an overview, an introduction to it, in nursing, we talk about how students would come to know different data, be it what they feel, what they experience, what they see, what they've read, what they've learned about from the research, because there are various different ways of understanding the world around us. My goodness, my mouse. And of course, it would act up today. But anyway. So Jennifer?
Yeah. So on reflection, yeah, and action. Multiple first-year students were impacted by student-recorded video assessments. Feedback received included one student describing an exacerbation for body image issues, including the disclosure of previous experiences with disordered eating. That student was unsuccessful in their first attempt for evaluation. Other students disclosed an increase in anxiety and inability to engage in small group peer review for their recorded videos and therapeutic communication. Students describe themselves generally with this as being unable to watch themselves.
And I've certainly had similar experiences over the years. I've taught in mental health courses and therapeutic communication courses. In the mental health course, there's been video recorded, and well, it used to be taped because we used to use the VHS tapes, assignments for years. Activities included students practice communication skills with another student or a standardized patient while being video recorded, then review the recording and analyze for evidence using good communication skills. And that used to be, we used to do that quite regularly. Some students were more comfortable than others, but and I wish in a way that I've kept a record of this over the years, but I haven't. But it's starting to come out more. Anecdotally, though, I have witnessed individuals conveying more and more discomfort with viewing the exercises in a group setting. And this is interesting despite this particular generation's more familiarity with having smartphones with easy accessible recording opportunities, posting recordings on social media, their own growing online presence, sharing videos on Instagram or Facebook or TikTok or whatever. And despite all of this, for whatever reason, I'm again, anecdotally, I've seen more and more students say, I don't want to show my video in front of the group. I don't like the way I look. I don't like the way I am on video. I don't like, so what's going on? And Jennifer and I had this conversation. What is going on here? So, in asking that, what is going on here? We started thinking about what are the experiences of instructors at MUN who have used video recording evaluations during the COVID-19 pandemic, and what impact does the use of video evaluations have on undergraduate students at MUN? We started to ponder that and started thinking about maybe doing up something, regarding that. And certainly when we saw the call for papers for this conference, we thought it'd be a great idea to present and get and just have a conversation about it.
So we're going to have a little discussion on the last slide. We're just going to ask other people if you want to go back, Nicole. The people are just went there. Yeah, because we have a comment coming in from Vicky Paddock again. And she said that it's a strange with what they actually post on social media. So good point, Vicky. I think that's the phenomenon we're noticing too. I think there is really a bit of a disconnect happening because like the generations that are in our undergrads right now, they do a lot of social media. But Nicole and I had discussed, like, is it the potential that they don't have filters when they're using their student recorded examinations? Is it because they don't have time to do 1,000 takes, like maybe they do for one post? So there's a bit of a disconnect, I think, with the literature and what's happening in the classroom. Ah, yes, being critiqued. Yeah, that too. So that comment's from Vicky as well.
Yeah.
Did anybody else have any other reflections that they'd like to share? You can just feel free, you don't even have to raise your hand. You can just jump in, turn your video on. We don't have a like incredibly large group. There's, I'd say, less than like 15 or 20.
Any comments?
I just have a comment. It's Janice Carew from CITL. Yeah, there's There's often, this is very enlightening for me because I didn't actually think about this specific issue. But we often see, for example, when people go into breakout rooms or they have to go into a WebEx session, that the numbers will drop off. And we know, it's a case for all of us. I think students, undergrad, graduate, professionals. There is that kind of discomfort when you're sort of put on the spot and different things like that. So I'm not surprised in reflection, but this is definitely a tool that I love to use I'm not an instructor myself, I'm an instructional designer. But I never really thought about that specific stressful kind of situation that we may be putting our students in. So maybe providing some options, and often there isn't an option if you need to actually see what they're doing, but to give some more critical thought about that, I think is very enlightening and informative. So thank you.
Okay, thanks, Denise. That's a great comment. So we have on the chat, and from Brenda Wyatt, there is something about feeling vulnerable or exposed, i.e. evaluated by peers. As faculty, for me, it is very intimidating to be presenting to peers. You know what, Brenda, I'd have to agree, because the moment I'm presenting and being video recorded, I go from feeling very natural to robotic. So, I mean, you guys can critique that and probably notice that for the rest of the presentation, but it's true. Brenda, agree. So hopefully you're agreeing to the first point and not me being a robot on the second. I'm just teasing. And Vicky Paddock is saying, I found with my students, she's LOLing. Okay, Vicky Paddock. I found with my students there was less anxiety as the recording were not live and they preferred this experience. So Vicky, that really echoes what's in the literature. So I find that very interesting. And she also has a secondary comment here. We told them that that only 2 instructors would be viewing their demonstrations. So that's good. I wonder if that little caveat is like, I always make a point, like when we were doing the health assessment, just part of that reflective piece, they would be very concerned about what they were wearing. And I would just let them know we're not judging you by your clothes, like we're not judging you by your backgrounds, like we're literally just looking at if you understand the health assessment. So I think that that's a really great point, Vicki, that might be an effective way of implementing this. Okay.
And Candace V has her hand raised, or their hand raised.
Hi, Jennifer and Nicole. I'm Candace Vaders. I'm a nursing instructor at Worson. Over the years, I've taught pharmacology labs and health assessment labs, and I'm used to doing in-person psychomotor skills assessments. So when we changed over to the video assessments, one thing I noticed with the students, we had more people being unsuccessful with the video assessments as opposed to in person. And it's funny because when they're in person, they have to prepare, like for example, for health assessment, they have 5 systems that they have to prepare for. They have to come in, they have no idea what it is they're doing, and it's more put on the spot. Whereas with the video assessments, they were given their particular system 24 hours in advance, and they had time to kind of prepare and do their video and put it together. They could have watched it many times, but we were getting, a lot of, which appeared to me, videos that were not reviewed. Maybe they submitted and they were missing very fundamental components within that assessment, which, we thought as instructors that it shouldn't be missed, but they were missing it in the video submissions. So I'm not really sure, what was happening there. If they didn't want to go back and watch it and they just submitted and hope for the best, I'm not really sure. But that was one of the things that I noticed from in person to the video assessments.
Okay. Yeah.
Interesting observation, Candace. Thank you for sharing that. And then there's 2 more comments, a few coming in again from Vicky here. So Vicky also gave them instructions on attire and the equipment. So that's really good to have that as well. So it sounds like your students got a lot of clarification before. So I think that's a great success strategy there. And she says, as an academic integrity statement and at beginning of demonstrations, they scan the room with the recording device. So that's an interesting point too, because we all know whoever's taught through the lockdowns that there's absolutely a question of academic integrity and how that ballgame has changed throughout the lockdowns. Okay, so we have, and Candace B, we also had students do that as well. Yeah, that was a really good way. We did that at the St. John's campus for health assessment as well. So that's a wonderful discussion there. Thank you. It's like we're on pros and cons.
Yeah.
Oh.
My apologies for my mouse. Every time I go to touch my mouse, it moves it. I have one of those magic mouse things, and it's very sensitive today. Sorry.
So we have, I guess we could get into some open discussion. We have talked a bit about the pros and cons already, but did anybody want to let us know anything else that they haven't shared? So again, thinking reflectively on your own teaching practices with students or instructor recorded video assessments, what other experiences have you had? And are there any pros or cons that you've experienced with video recorded evaluations? And has that again changed throughout, like with use of the lockdowns, with the extra restrictions that we've had? Or when you were doing the transition? Oh yeah, we've got another.
Wanda, can you hear me? Oh, sorry.
Oh, hi, Wanda.
Wanda.
Oh, hi. I think somebody had their hand up. Maybe I should wait.
Oh no, you go ahead. We'll have Candace speak
Okay.
afterwards.
Yeah, hi. I'm currently teaching in the BSCN program at the Center for Nursing's nursing studies site, but I was also involved in the graduate program for the nurse practitioners. And so in 2020 and 2021, we had to do, as part of their final testing, which is called an OSCE, so it's an objective structured clinical examination. Normally it's done, in person, but I had to develop it to be done online. And so as part of the preparation for that, this is at the very end of the program, so it's very high stakes. And it's a pass-fail component. And so as a result of that, I did sort of a mock preparation for them prior to doing their final testing. I did a lot of mentoring with them, I guess, and overall coaching. And because, as you could anticipate, they were extremely nervous because they knew what this meant in terms of their overall evaluation and finishing the program. So they found the mock piece extremely helpful. And then I was the only individual actually who tested them online, which they found beneficial as well. And that was a small class. What I mean by a small class was, I think, 14 in the 20 class, and in the 21 class with 18. But I did it over a two-day period. And they found that very beneficial as well, rather than usually in person, there are several individuals that test them. So they found that a benefit as well.
Oh, that's really interesting, Wanda. So it's another beneficial success strategy. So for anyone in the group going through, I guess, the mock presentations, it's a wonderful idea. And Vicky says she's unable to give immediate feedback as a con, but told them we'd reach out to meet if any concerns. Candace B is saying, agreed, Vicky, not having that opportunity to give immediate feedback is a con. Vicky Paddock, this is another one that's echoed in the literature. Candace, I'll just read this one comment and then we'll hear from you if you want to turn your video or your mic on now. Vicky Paddock is saying more labor intensive to set up, watch videos, and evaluate in a timely manner. We had 2 weeks, 45 students, 3 to 4 demos per day. So as not to burn us out. Wow, yeah, that's a lot of increased workload. So Candace, if you'd like to come on.
Yes, one of the other things that I found during the pandemic, especially for pharmacology labs, with regards to supplies and being able to accurately demonstrate the skill. Students were given supplies at the beginning of the semester. They were using it to practice because we were doing, virtual demonstrations. They were practicing throughout the semester. So I found when they were doing their video submissions, sometimes they didn't have the appropriate supplies to be able to accurately demonstrate. And I found that became an issue for students, which would stress them out, and not, impact their ability to be able to perform properly.
Yeah, that's really interesting. I know just doing the first year health assessment course for BSCN students at the St. John's campus here at mine, the students didn't have the opportunity to practice in-person skills. So that was a really big one. And we had, limited ability from having, the two-person blood pressure assessments that we would do, where we'd have the stethoscope where we could listen as well, usually. So they were sort of going through these skills by themselves. I think that's a really good point. And then Vicky is saying, same Candace, I told them to improvise. One student used a teddy bear and a belt on a stethoscope. It's kind of sad and sweet, isn't it? Oh dear. All right.
Well, thank you for your comments.
Yeah, good discussion.
Yeah.
So we're going to go through the literature now. And oh, some students got creative, that's for sure. Yeah, I think one of my group, whatever worked, I think one in my group might have used their cat. I'm not sure. It's a little hazy. I have to go back and check the videos. I know they definitely talked about their cat during it. So for the literature, you might find that some of this echoes and resonates with you, with your experiences. So a general overview for the topic was conducted and articles were retrieved from CINAHL, PubMed, Scopus, and Google Scholar. So for the nursing literature, there was a lot of prose that were discussed. So literature retrieved specific to nursing that reviews the pros and facilitators for video recorded evaluations demonstrated that there was a reduction in anxiety in nursing students recording in-home environments during the COVID-19 restrictions and lockdowns. Comparable outcomes were noted for traditional face-to-face evaluations. For example, final scores compared between video and in-person assessment for physical assessment for various forms of evaluation for nursing students demonstrating these skills. A cross-sectional study by Papura and Priyan examined the use of recorded video assessment for physical assessment in nursing students and reported that participants generally found this assessment modality effective with few barriers, although the exact barriers were not identified by the authors. A descriptive and interpretive study conducted by Strand et al. In 2016 indicated that digital recording provided students to feel safe, secure, and self-confident when learning practical nursing skills. The authors support that video assessment viewing may benefit peer learning by providing immediate constructive feedback. So we had some discrepancy there with what we just talked about. So McDonald et al. In 2020 proposed that video record assessments may provide more individually tailored feedback for students. And I'll have the next slide, please, there, Nicole. So some more pros related to nursing specifically. So learning through videos may appeal to millennials who benefit from appealing graphics and video content compared to teaching modalities that are traditional, for example, text. This form of evaluation may also enhance the transferability of nursing knowledge to clinical practice. And video demonstrations were demonstrated as allowing students to demonstrate evidence-informed nursing practices and application of nursing theories to best practices. Now, if we go on to the next slide here, we'll look at some of the cons and the barriers. So literature specific to nursing highlighted some of the cons and barriers to video recorded evaluations, included the stress for the rapid transition for allied health educators during COVID-19 pandemic due to restrictions with in-person learning activities. This reported an increased workload for educators when viewing video assessments and limitations for manual skills that require physical contact, for example, palpation techniques. Students experience social isolation, for example, living alone, may not have access to peers or family to practice practical skills, for example, health assessment and therapeutic communication. With support, the use of adaptive assessments such as robotics to avoid video assessments for skills requiring touch, and this cannot be effectively assessed via self-recorded videos. Some authors note experiencing limitations and challenges implementing video assessments during the COVID-19 pandemic, but do not appear to be measuring or evaluating these as readily as the benefits for recorded video assessments in nursing education. Then we also looked at some general literature. So for this particular one, we pulled from medicine, nursing, pharmacology. So video-based educational interventions for teaching and learning, including animated presentations, professionals in practice, and patient narratives that may improve patient outcomes. And video-based feedback, or VF, for medical students was shown in the literature as it may help medical students develop a sense of empathy for their patients, enhance surgical skills in medical residents, cause stress when recording and watching oneself on video. And VF presents challenges for instructors to relate VF to theory and medical training. So that sort of contradicts what was going on with nursing there. And video evaluations for Australian medical students for the OSCEs, so similar to what our NPs do. So the objective structured clinical examinations have been demonstrated as having no variation for time and performance from in-person, and they were noted as being safely adapted to meet health and safety guidelines during pandemic planning. Video-based assessments in medical education were noted as requiring non-intrusive camera placement to reduce negative influences on the student for filming evaluations and can enhance the validity of assessments. Video recordings of interprofessional education have been shown to improve communication and interprofessional error disclosure for dental, nursing, and pharmacy students.
We also did a search for considerations using recorded assessments and students' mental health. And we did find that there are some links between virtual learning and the influence on mental health. One longitudinal study found that male youth experienced higher levels of anxiety and depression due to electronic learning during the COVID-19 pandemic, and that was Lee et al., 2021. Rogers et al. Believes that the context of the COVID-19 pandemic has created global conditions likely to increase the risk of eating disorders, for example, with disrupted routines and an increase in sedentary lifestyles. Then there's the generational considerations that we also must consider. And I guess, those of us who are not of this generation, whom we are teaching, or the general student population, certainly there are older students, but when we think about the millennial group, 9 in 10 millennials, so these are individuals who are turning like around the age of 23 to 38, thereabouts. They own smartphones. And which is less than my generation, or more, sorry, than my generation of Gen Xers, and certainly more of the generation of baby boomers. And Generation Z, that's the majority, certainly not all, but the majority of individuals that we are teaching in undergraduate nursing programs have lived their entire lives with technology, such as Wi-Fi, social media, the internet. A survey conducted by the American Psychological Association notes increased self-reports of mental health concerns in this generation. 91% reported stress, 27% report fear to poor mental health, 37% have sought treatment from a mental health professional. And that correlates with some of our recent data on mental health and mental illness in the general population, with anywhere from 1 in 4, 1 in 5 having a diagnosable mental health concern within their lifetime. And we also must consider that these individuals have lived through the greater efforts that our generations are putting out there to discuss mental health concerns, and the increased rates could be a result of this active anti-stigma work. It's difficult to tell. Then there's body image, and body image is the picture that we have in our minds of the size, shape, and form of our bodies, and our feelings concerning these characteristics in one's constituent parts. And the images there on your right are from this Canadian Mental Health Association BC division, and they depict the interrelationship between body image, self-esteem, and mental health. The top image is one that promotes, that is illustrative of positive mental health and positive body image, and the one on the bottom is negative body image and negative self-esteem, poor self-esteem. And so from a mental health perspective, there's a well-established connection between mental health, self-esteem, and body image, and few studies have been conducted exploring the relationship between body image and viewing oneself on video. I did find one study by Shuden Kafier et al., and that was from 2003, that found individuals with bulimia nervosa have increased negative emotional responses when observing themselves on video. So it's not something that we're seeing a lot of explored, but certainly, it's something that we're concerned about and was raised to us.
Okay, so with all of that in mind, oh, we have a couple of people who have other meetings. That's okay. We'll forgive you. Um, so we have a couple of people leaving. So for those that are staying, we do have a case study that we're going to do a 10-minute breakout room and then a 5-minute group discussion. And then for the scenario here, you'll just want to think about the student and the instructor considerations. I'm almost wondering if maybe it would be best just to do like 2 breakout rooms and then we can kind of meet together, because I know some people might have something going on in the background during this. Yeah.
I'm also mindful of the fact that it's 12 o'clock now.
What is it? How much time do we have left? Is it 20 minutes?
This is John speaking. You have 15 minutes remaining in your session.
Oh, okay, so why don't we do maybe a 5-minute breakout room and then we'll do a few minutes and then we'll leave it open to questions?
Yeah, sounds good.
Okay.
You would approach this, you're teaching a first-year course. I think I'm Jennifer. I'm jumping into your slide.
It's totally fine. Yeah, it's all
You're teaching
good.
a first-year course for students enrolled in a health science program in the therapeutic communication course. Students are required to submit an 8 to 10-minute student-recorded video to demonstrate that they can establish a therapeutic rapport with another person of their choosing. You have a student in your section who is newly immigrated to Canada, lives alone, speaks English as a second language, has a history of mental health disorder, generalized anxiety disorder, previous experiences with test anxiety and disordered eating. They are not currently enrolled with the Blunden Center for Support. The student discloses feeling a bit concerned in their upcoming video recorded assessment. And how would you approach this scenario as their instructor? Anyone want to jump in? Make a comment?
Okay, so we've got a comment coming through. Vicky Paddock is saying, I would first have a meeting with a student to strategize on how they can complete this endeavor. Ask them if they have met with the Blunden Center, and if not, give them their ASAP. I would probably give them more time if okayed by student services for accommodations too. I would help them to understand the need for this type of learning and how it would be beneficial for them in nursing, plus support. So that's good. So very supportive approach from Vicky.
Yeah.
What other considerations might you have with that?
Brenda got her hand raised, I see.
Yes, no, we were just talking in our group there that yeah, in addition to linking them to the Blunden Center, I think is important to meet students where they're at, and what does it mean when she say a bit concerned? Was it language barrier? Is it a cultural thing where it's not not something they're used to? Different, and of course the mental health concerns, the disordered eating, to test anxiety and all that. So to kind of gauge where to go, you kind of need to learn where the student is at, I guess, and within the confines of the academia, everything that we're guided by as well, which I guess is the whole point of all this whole conference, is to decolonize and to move forward in how we support students. So that would be where I would start to see what's concerning for that student, and then bring in the resources.
Yeah,
that's great. Thank you. So we have 2 comments, and then I think we had another hand up. So I'll go over with the comments. So Ulrika is on, and she says, explore further what the student means by concern. So she picked up on that one piece. That's really good. The details of what that means. So that's a really good thing to unpack, Ulrika. And Candace V is saying, work with the student to determine their specific concern, refer to appropriate supports based on the specific need. So I think that's really great. And then we had another hand up, I believe.
Denise Carew?
Yeah.
See your
Yeah, I
hand up.
agree with what was just said and what's in the chat as well. But I know the rapport thing does seem like a communication piece, and that it's important, that verbal communication, and that you can see body language and things like that. But I'm wondering if it's possible to ask or to think of some options that a student could have that would be different from that actual physical rapport building that you might see in a video with another person. Interesting that there was a presentation yesterday from chemistry, and the individual, I don't know if anyone saw that video, but it was a 10-minute talk, and the instructor, Chris Kozak, I think, he had students do, he gave them 5 options to do a presentation. And you wouldn't think that with chemistry that was a viable option. Students could do a TikTok video or a different type of video. They could do a poster presentation. They could write a poem, etc., etc. So those were all things I think that he came up with, but I'm sure that students could be creative as well. So, it's sort of thinking outside the box, perhaps, to see if there's a different way that you or the student could come up with that might allow them to demonstrate that competency.
I think that's really interesting, Denise. I think for me, with the cultural consideration, one thing I learned where I did my training with my PhD is that I went to Western University. There's a lot of international students, and I learned from just friends that were from Africa, like all over the world. Some countries have specific cultures where they don't ask questions to instructors at all. And I learned that from a few roommates from Nigeria, where they're like, no, we're not to do that. So I think for me, I always try to make a point at the beginning of the semester to say, like, always ask me questions. Always, if you're not sure, like, come and talk to me. And just to let them know that that's like the whole group, like, so it's not centering anyone else, because you don't really know sometimes where people are coming from or what their experience with education has been like. But that's something that I feel like I try to do even at the beginning of the semester. Yeah. Okay.
Great.
Good discussion.
So, it's excellent discussion. We thought, 50 minutes, this is wonderful, which is absolutely, it is wonderful, but with the opportunities for the questions, and we thought we'd incorporate the questions and discussion throughout, but it's 11 minutes after 12.
Got 3 minutes left. So
Yeah. So we won't get you to discuss these, but how about these as takeaways, let's say. So for something for everyone to think about, how do we improve teaching practices that involve emergency orders, pandemic planning, or changes course delivery that may involve how we implement evaluations? For example, the use of student recorded video assessments versus in-person demonstrations. What might you do differently for future pandemic planning? I really hope we don't have another one, but we're not really out of the first one, really. Not yet. Or the use of video assessments in your courses. How can we promote universal design for video assessments? So, as Jennifer mentioned, not just mentioning it for individuals, specific individuals, or doing things for specific individuals, but how do we create a design that is inclusive for everyone, that can benefit everyone using those principles of universal design? And do you believe video assessments can be made more inclusive? If so, how would you recommend this? And how do we promote students' well-being with video recorded evaluations? That's something really to consider as well. What we do also has to be safe for students in which to do it. And this was another case study if we needed to have any
we could move forward.
extra time, and we
We've
don't.
got 1 minute left. So I think we'll leave the questions that we posed as like reflective take home, unless anybody really has something they want to share. Did anybody have any last comments or questions? And we did. We really filled that time. Good job, group. So Vicky's saying that this was excellent. Thank you. Nice to know I'm not alone. Oh, that's nice. I think it's really important that we get together and have these discussions academically. So thank you, Vicky. First, establish a trusting, caring relationship with students if able. If time permits, start small with another recording evaluation. So that's a good. That's kind of goes into the point that we had on the OSCEs with the NPs that was being made. Thanks for the great session. Opportunity for great discussion. Oh, thank you. Thank you, everyone. David saying, thanks for your presentation. Thank you for joining us. Great questions to think about. This was a great presentation discussion. Thank you. Well, that's great. So just more like nice comments. Okay. Well, thank you.